Yo, it's your boy, number 5. There you go, right there. Bang! Got all my paraphernalia in check today. Coming at you with episode number 2 of my 5-monthly series of Diaries of Doctor Number 5. I do apologize for the delay, but there's been stuff going on in the world. I've been busy. Anyway, I don't really want to talk about what's happening on the big scale because I'm sick and tired of it. I just want to tell you a story. And, the main subject of this story is regarding social distancing and protective equipment. So let me just set the scene for you real quick. This one isn't actually from very long ago. So I was working in a large hospital in the Leicestershire area, working in the acute medical unit, which is the place just behind A&E where we see the patients who are unwell, who need to go somewhere in the hospital but might not be stable enough to go. And a bit of education for you all. Sometimes we have people that come in who have been doing drugs, believe it or not, and a lot of those people are doing drugs we don't really know. Now, one drug we do know a lot about is heroin, okay? And the thing about heroin is it can make you real sleepy and make you stop breathing in a worst case scenario. Luckily, there's an antidote for it, and all we need to do is just pump it through your veins, and like that you'll snap out of it. The downside is you snap out of it and a lot of people come out and are very agitated, very anxious, and this is not a good recipe when you've got lines in your arms, a tube in your penis, and all kinds of stuff going on, so it has the potential to be quite dangerous, not only for the patient but for everyone else around you. Hope you enjoyed this story. So there we were, working a night on the acute medical unit. I had my colleague, Dr. Tenny, top lad, who was alongside me as one of the SHOs. And we had a lovely Oriental registrar. She's a small lady, but very knowledgeable and very pleasant to work with. So we had this 29-year-old lad who, between us all and the healthcare assistants and nurses we were looking after, we thought he might have taken a mix of different drugs, and heroin was probably one of them. So we gave him this slow IV drip into his veins of this medication called naloxone. That's the snap medication. Because we're giving it real slow, we're hoping that, nothing was gonna kick off. Yeah, so in the middle of the night, stuff kicked off, innit? We hear this loud bang, and me and Tenny just stuck our heads outside the doctor's office and saw what was going on. And one of the healthcare assistants, bless him, he walks into the room, and the guy was just going nuts. Okay, so he's pulling his stuff out, pulling his tube out of his lully, that's his, and getting rid of his lines. There's blood squirting everywhere. He's pushing trolleys over. Anyway, so we kind of look at each other and think okay, we're gonna have to do something about this. Meditation. Hi, back once again from meditation, feeling very serene. So where was I with this story? Oh yeah, so this guy was kicking off, and one of the healthcare assistants had gone in there. Tenny and I, reluctantly went down the corridor to see what was going on. And the guy, I didn't really tell you about this, but the guy was the size of a fridge. He was 30-something, but he was built solid. And I wasn't going to go mess around with a guy like that, So he was angry, he was throwing stuff everywhere, pulling lines out. The only line that he'd left in was the naloxone drip, which is probably the thing that got us in this situation in the first place. Anyway, so the healthcare assistant comes out looking a bit dazed. We're like, bro, are you okay? He was like, oh, and he just kind of caught me with the phone in his hand. I look at his head, and there's a lump the size of a golf ball on the top of his head. I was like, bro, you just sit down. He didn't even realize. Anyway, so get him down, get him sat down and arrested, and me and Tenny are looking at each other like, oh crap, we gonna have to do something here. There's people around starting to panic, and they're losing faith in us right now. And this is when you're on the right frequency with your colleague, because he looked at me and I looked at him, and Tenny was hardcore. He'd seen a lot of medicine around the world and they did things aggressively, and he looked at me like, and I was like, oh, no, 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 no. We are not going in there. Did you see the size of the knot that he just put on my man's head? There's no way I'm going in there, Tenny. It's not safe. Because that was the first thing we were taught. You know, you look after yourself first, because if you can't look after you, you can't look after no one. After all this commotion, our registrar, bless her, someone sensible must have called her, said, come and help these two idiots out. So she came trotting to the other side of the corridor, and we saw her poke her head around the wall. She was like, hey, turn off the naloxone drip. I was like, bastard, you come down here and turn off the naloxone drip. Have you seen this guy? In the end, with the help of all our team, including security, and the nurses, and Tenny, who volunteered to go in there, crazy son of a gun, we managed, we managed to subdue the gentleman and, you know, get him back on track and replace all of his lines and all that kind of stuff. And I'm forever grateful to all the team that was there on that night, and I'm always reminded of the fact that you cannot ever go into a situation without protecting yourself first. And I think at a time like now, that's more relevant than any other. Okay, so I hope you enjoyed that story. Till next time, peace.